Hi, I'm Jan Marini, the founder of Jan Marini Skin Research, and I am here with Kathy. Kathy is a hypnotherapist, and she was actually referred by Lisa. Lisa was our very first YouTube consultation. So Lisa, thank you so much for referring Kathy. So Kathy, I'm going to ask you a few questions. If there was something you could change or improve about your skin, what would it be?
It would be getting rid of these kind of the aging spots and the scars from childhood, and just making my face look refreshed and the wrinkles and stuff that comes on with age.
Okay, so age and sunspots, scars from childhood, and you mentioned some wrinkles. Anything else you want to change or improve?
Maybe the pores. I believe
Okay.
my pores are big.
Okay.
From what I've heard. Large pores.
And anything else you can think of?
I'll leave it up to you.
Okay.
Yeah.
So do you think your skin is more normal? Do you think it's a combination? Do you think it's dry? How would you categorize it?
I would categorize it as normal to a combo, but probably oily in some spots and dry in some spots.
Where do you think you're oily?
Probably here, around my nose, and maybe cheek area. But I would say.
And would you say more
forehead.
like the inner cheek area?
Yes.
Okay. And forehead. So kind of the T-zone.
Right.
And do you feel like you are oily enough during the day that you feel like you have to blot? That you, if you wear foundation, that it's very noticeable, or do you feel like it's just slightly?
It's slightly. It's
Okay.
Yeah.
And you mentioned that there's areas where you feel dry. Where do you think you're dry?
Sometimes it pulls in through here, this area. Probably, where do I feel more dry?
Like the cheek
Around
area?
the eyes, maybe around
Okay.
the cheek area, outer cheek area.
Now, when you say your cheek area feels drier, does it feel real tight and dry? Do you flake, or do you just feel like it's just more where maybe certain times of the year you need more moisturizer?
That could be. So
Okay.
it could be normal to dry. I would
Okay.
say it's extremely dry where it's, yeah.
And that's actually pretty much combination skin. Combination skin, which is usually more normal in the cheek area, actually can be drier in colder weather or under certain conditions, and you may need a little bit more moisturizer. So that's pretty much normal to combo. Were you ever a smoker?
No.
And were you ever a sunbather?
No.
And how about, did you ever have acne as a teenager?
I didn't have bad acne as a teenager. I say I was good as a teenager. In my mid to late 30s is when I saw more acne, and it's usually around this area that I'm seeing it more.
So when you were a teenager, did you break out at all? Did you have mild acne? So nothing really?
Nothing too extreme, no. I have
But any breakouts at all?
once in a while, yeah. I
Okay.
would have breakouts, but it wasn't anything
About
that
2 to 3% of all teenagers don't get acne. And we always talk about teenage acne being hormonal, and yet if teenagers didn't have hormones, if they don't have acne, then how would they be able to procreate? So the hormones play a role, but it's not always hormonal. But you had a little bit of acne. Okay. So then you mentioned later on you started to get it, but it was more in the chin and the jaw
Yeah.
area, okay,
Yeah.
which is really common. Because so many times people will say, well, I had very mild acne as a teenager, it went away, or I didn't have any acne, and now I'm in my 30s or my 40s or whatever, and I've got it on the jawline. And tell me about when you break out in this area, do you ever get do you get papules that turn into pustules, or do you get those harder nodules?
it's more of the pustules. It's white heads that, I managed to squeeze them out. A lot of pus does come out.
Okay.
Yeah.
And about how old were you when that started?
I would say mid-30s,
Okay.
about 34, 35.
Okay. So let's talk about what you use. What do you wash with in the morning?
I have a glycolic cleanser that I use.
And do you know what the brand is?
I don't. I don't.
Do you recall if it's a drugstore brand?
No, it's not. It's from my esthetician.
Okay.
Yeah.
Is it a creamy cleanser? Is it a gel or is it a cream?
It's like a gel, clear gel type.
Okay. And the reason I ask that is because if it's a gel, it's usually all skin types or combination skin. If it's a lotion, it's usually normal to dry. And if it's a cream, then it's going to be something for dry skin. So that kind of gives me an idea. And what do you do after that? What do you put on?
After that, I put a natural moisturizer, day moisturizer on.
Okay.
That has sunscreen in it as well. And I buy it from a natural store.
Do you know what the SPF is?
I believe it's 20.
Do you say broad spectrum?
Yes.
Okay. And so, and it's natural. So do you get it from like like Whole Foods or something like that?
I buy it from Rainbow Grocery Store in San Francisco.
Okay.
And I'm trying to think of the name. It's probably a pretty common name. It's Dermal.
And is there anything that they feature in there, like they talk about that they have a certain ingredient or certain technology?
I don't think so. I think it's just a daily moisturizer to wear every day.
And anything you put on after that?
Sometimes I'll put on foundation before the makeup, and sometimes I won't. And I'll just put my makeup on. But
So sometimes when you say foundation, you mean like a liquid makeup?
yes.
Okay, and any particular brand?
I use the Laura Mercier
Tinted?
tinted. Yes.
Okay. That is a popular product.
Is it?
Yes. It's a tinted moisturizer. Do you use the regular one or the one for oily skin?
The regular one.
Okay. Okay. And at night, same cleanser?
Same cleanser, and then I have a night cream with this vitamin C serum moisturizer that my esthetician gave me to use in the evenings.
So it's a cream and it has vitamin C in it. And again, you don't remember the brand though.
I don't. I think she puts her own labels on.
Okay,
if
so
I'm
it's
not
private
mistaken.
label.
Yes.
Okay. Anything that you do after that? After the
nope.
vitamin C cream?
That's
Do you ever do scrubs, ever do masks, anything like
I
that?
do. I do. She also gave me a mask that I mix with water. So twice a week I use that, and I leave it on for about 20 minutes, and then wash my face.
And what?
That's pretty much it.
So this mask that's mixed with water, is it a clay mask? Does it have a particular ingredient?
It's it's like a clay mask, and then I just have to kind of add more water to be able to put it on. I don't know what's in it. She just mentioned that it's good. It's a good exfoliating, and it just kind of.
Does it have granules? Do you work it around afterwards and
It does
kind of
have
like
granules in it. Yes.
So when you take it off, you can kind of scrub it a little bit.
Yeah. Yes.
I'm writing. Okay, so let's go back to some of the concerns that you have. So tell me where you think you have age spots.
I feel them in my cheek area mainly,
Okay.
And a little bit discoloration around the
Okay.
chin.
And when did you start seeing the discoloration?
I would say early 40s, probably.
Okay. So it wasn't necessarily in conjunction with pregnancy.
No.
Okay. You mentioned scars from childhood. What type of scars?
I believe they're mosquito bites because I was really allergic to mosquitoes, and then I would scratch them, and chicken pox.
So now when you say scars, do you mean you actually have depressions?
I feel like I do. It's gotten better over time.
Or is it mainly discoloration? So there, a lot of times what happens when you have an acne scar or something that's a trauma to the skin, depending on your skin type, if you're really fair complected, it can start off and it might look very red afterwards, but other individuals develop more of a brownish, purplish looking, and they refer to it as a scar, but it's not really a scar, it's discoloration, which can take a very long time to go away if you don't treat it.
Okay, and I believe that's what it is.
Okay.
Yeah.
Where do you think you have wrinkles?
Wrinkles around the eyes,
Okay.
the forehead, especially this area, and the forehead, and around the lip area, I believe.
Okay, so between your eyes and the nasolabial fold.
Yes.
And where do you think you have large pores?
I feel my cheeks have large pores, my nose, and some areas of my forehead.
And tell me, what, if anything, you do that you think makes your pores look more refined? And what do you do that you think makes them look less refined?
I think makeup really helps me, but I don't know. But I think
Well, instead of camouflaging them, like what do you think you do that actually makes them really, truly look smaller?
look smaller. I think if I do the rigorous process of doing facials at the appropriate time and doing my skin regimen and following through with what is actually needed, they look better than when I don't.
Okay.
Yeah.
Okay.
And sometimes eating, drinking more water, all of that I think internally also helps.
So when you say eating, is there something that you eat that you think makes your skin look worse, and something you eat that makes it look better?
Yeah, I think when I consume mainly greens, which is vegetables and salads and vegetables, I feel like my skin looks better versus when when I'm more of a vegetarian diet versus when I do eat meat or especially greasy food. I feel like my skin doesn't look as well.
Okay. So the reason I asked that question is not because I'm looking to see if somebody's a vegetarian or a meat eater, because actually protein is really good for your skin, and lean meats and things like that are actually excellent. What can affect your skin and cause inflammation, and aging is an inflammatory disorder, is carbs. So even though you may think, oh, what's wrong with pasta? If it's pasta, it's bagels, it's bread, it's pastries, it's anything. And also, the other thing is that even though you're on your breakout situation, it's conclusive that milk causes acne.
Yes.
And this is a study printed in the American Academy of Dermatology done on 47,000 nurses. And then it was repeated on their sons and daughters. And then there were two other studies, 3,000 each of girls and boys, teenage girls and boys. And sometimes when you have just mild adult acne, you're not having the nodules or the cysts. Very often, just getting rid of some of the inflammatory aspects of the diet can make a huge difference. So that's why I bring that up, and also just make the skin look better. So it's not so much eating greens and veggies and all that is great, but it's not really. It's the carbs. It's the carbs. Okay. So in general, what you're talking about is general skin rejuvenation. And you mentioned it yourself. You said, "Gee, I would like to look fresher. I just want to look." What I'm getting from you is you want to feel like your skin has a glow to it, and you want to feel like it's even, and you want to feel like it has the texture is very refined, whether you wear makeup or not. And I always say it's that. The red carpet look. You see people walking down the red carpet and you think, oh, they don't even look like they're wearing foundation, or they're probably wearing lots and lots of stuff on their skin, but they just kind of glow and they look perfect. So that's all the things. When I say skin rejuvenation, I don't just mean fine lines and wrinkles. I do mean texture, large pores, mild to moderate acne, rosacea. It can be discoloration. It can be all the common skin concerns that we want to address, fine lines and wrinkles, all of that. So that's what we're going to talk about. So a couple things I want to mention first about where you mentioned about fine lines. So most of what we look at when we look in the mirror and we say, well, you know, I see certain things happening, but it's got to happen sometime. Doesn't everybody age? Blah, 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 blah. 90 to 95% of what we perceive as inevitable aging is sun exposure. Most of which happened before the age of 10. It gets programmed into your skin. At least 50% is programmed in by the age of 20. So it takes 10, 20, 30 years to show up. And it's so many times people don't really notice much in the way of aging in their 20s or their 30s. And then it's almost like one day they'll say things like, I looked in the mirror and I noticed that this happened, or I looked in the mirror and it looked like somebody was letting the air out of my face. And things just start to shift. And unfortunately, because it takes a while for it to show up, once it does though, it's kind of a cascading effect. And it just gets going and it gains momentum. So the fine lines and wrinkles caused by sun exposure are one type. The other one is known as dynamic muscle movement. Now, dynamic muscle movement, you could live in a cave, never had any sun exposure, but it comes from expressions. And what it does is it makes a crease in the muscle. And when you put the skin over it, there's a line there. And unfortunately, now we can soften that. And particularly if it's the lines that are here, forehead lines, those are dynamic muscle movement, and we can soften those. And also if you have lines that are going this way, boy, it can make a big difference with those, the appearance of those. But it's Botox, because what that does is it erases the memory of the muscle in that area. And the way that they do it today, it doesn't mean that you don't have movement, because other muscles take over. And I'm not saying that you should go out and have Botox, but just realistically, what can you hope to accomplish? Now, the other thing, the nasolabial folds. Okay, well, here's the issue with that. The most feminine feature of the female face is the cheekbone area. And it has to do with volume. So it's if you have high cheekbones, but also it has to do with the hygroscopic factors you have in your face, of one of which is hyaluronic acid. And it's estimated that as much as 50% of what we perceive as aging is loss of volume. So in a well-volumized face, your cheekbones are going to be the highest part of the face and the widest part. And then it narrows down into a well-defined jawline. So actually, an ideal face shape is really heart-shaped, not necessarily oval shape. So as we age, what happens is, and when you lose volume and also gravity, your cheek pads begin to move down. As they move down, you get a nasolabial fold. If you were to grab that cheek pad and push it back up, the nasolabial fold pretty much disappears. And then the platysma muscle, which is the muscle in the neck, big muscle, that when they do a facelift, people think, oh my God, they're pulling the whole face up. No, facelift is really a lower facelift. They're really pulling the platysma muscle up and that lower part of the face. As it pulls down, it takes the corners of the mouth with it. So you get sort of a downturned appearance. And then everything elongates as we age, even earlobes, about 1/3 of a centimeter in men, a little bit less in women. And sometimes you see older women and they have really elongated earlobes. Well, even your upper lip elongates. 80% of all females by the age of 60 will lose the show of upper teeth. And what that means is that if you're not smiling broadly, you're just rested. Or if you're talking, a lot of times people see the lower teeth and not the upper teeth. There's even a little test you can do. When you look at yourself in the mirror and you do this, you go, M. Where does your lip end up? There should be a certain amount of upper tooth show. And so the lip actually elongates, it starts to turn under and it starts to flatten. And that's all part of that whole nasolabial fold and everything. And doctors have this horrible name for it, they call it horse lip. But it's one of the biggest procedures today is lip shortening. And back in the Renaissance days, you guys that have tuned in have heard me say this before, but when they would paint people that had, women that they were going to immortalize forever, and they wanted to make them look a little younger, they would actually shorten their upper lip in the picture.
Oh, wow.
So anyway, so that's that's the depressing part. But the other factor is that 90 to 95% of what we perceive, a lot of the textural changes, the brown spots, all the other things that really give our skin luminosity and make it look bright and smooth and youthful looking, that's all sun exposure. Those are things that we really can do a lot for the appearance of that. And so kind of that's what we're going to be focusing on, and large pores, all of that. So there's a couple of things that I like to focus on. Number one is something called resurfacing. So resurfacing is a way of addressing a lot of those superficial imperfections. It's usually done with an acid or combination of acids. Okay. Now you're using glycolic acid, which is good. But glycolic acid is a little tricky because we know that medically, if it's at a pH of 3.25, that it stimulates collagen. And it does all kinds of great things for the skin. But if you have a pH that's higher than that, you are neutralizing it to the point where you may not be getting the effects of it. So again, I don't know what brand you're using, so I'm not certain how well it's doing on your skin. But one of the things about glycolic, and one of the reasons it's good to use in a cleanser, is you can have a great cleanser that doesn't have glycolic in it. I make cleansers without glycolic, but glycolic has a molecule that can actually get down into your follicle. And what it does is it helps to break up follicular retention. And when it does that, it makes the follicle relax and it makes them look much smaller. But again, I don't know what pH you're using. So resurfacing deals with things like large follicles. It deals with things like textural changes, and it deals with dark spots, the appearance of dark spots and mild to moderate acne and all that, just all those superficial imperfections. Second thing is we want to use some topical agents that actually can help to reverse the appearance of some of the damage that you sustained over the years. It's kind of programmed into your skin. And then we want to prevent future damage. That's really important. And even some things as simple as using the right sunscreen, do you know that they've actually determined that if an individual starts using sunscreen and they're using one that really does protect them, that 5 years later, they will look younger than when they started using the sunscreen.
Wow.
But there's other topical agents that can really help with the appearance of aging and can make a big difference. So that's kind of what we're going to focus on. Okay, so here's what I'm going to recommend for you. Number one, we're going to put you on the skincare management system for normal combo skin. And usually, unless somebody is really, really dry, I do normal combo because it's typically much more than what they're used to using to begin with. So that people, one of the things they say right off the bat in just the first couple of days is, oh my gosh, my skin just feels so hydrated, but it doesn't feel oily, and it just has much more of a glow, and it looks so much more refined. So this is a skincare management system, and this has a glycolic cleanser in it.
Okay.
It has a lipid-soluble vitamin C with something in it called dimethyl ethanol, which has actually been shown, this isn't a medical study, but it's actually been shown to really make a difference in the appearance of the contour of your face and kind of the appearance, more of a lifted appearance. It has something in here called BioClear. BioClear is glycolic, salicylic, and azelaic acid. One of the questions that people always think, whether they say it out loud or they're wondering, well, how could we all be on the same system but have different concerns? Because many of these ingredients are multitaskers. So for example, BioClear azelaic acid is sold by prescription for acne. It's sold by prescription for rosacea.
Right.
It's also one of the best things we've seen for brightening the skin in terms of pigment. And when you put it together with glycolic and salicylic acid, it is the best I have ever seen for the appearance of fine lines, texture, pore size, making the skin just look really bright, really smooth, translucent, all of that. Then the hydrator in here is transferrin growth factor, or it's called Transformation, but it has transferrin growth factor beta 1 in it, among a bunch of other technology. that is a technology that Dr. Guido of Jefferson University says helps to stimulate type of collagen it produces after the age of 30. And so it's great for the appearance of some of the things that you've talked about. We also have the sunscreen. It's important that sunscreen should be at least an SPF 30 because we don't apply enough of it. So even if you don't quite apply enough of it, you're going to still get adequate coverage with an SPF 30. But the thing about this is it's got a lot of other elements in it. It has something called phytomelanin. Phytomelanin, in this particular case, is chemically identical to human melanin. Human melanin is the most protective factor you have in your skin. And it's anti-aging, it's anti-inflammatory. And that's why people with really dark skin, they just don't have lines and wrinkles. You look at them in their 70s and 80s, they don't have lines and wrinkles. So this really enhances the effects of the sunscreen. And there's a lot of other things that are in here, but one of the reasons why this is so popular is because it has an oil capture system. And you can have, if you have combination skin or areas where you're somewhat oily, slightly oily, a lot oily, it has the ability, almost an unlimited ability to capture oil, to absorb it, but it cannot absorb the actives and it can't absorb the water. So your skin just feels so balanced. The comment we get all the time is, how can I possibly put on this many products and feel like I'm only wearing one product? But it's layered technology, and you're not going to feel like you're wearing a lot of product on your skin, and you're just going to feel very, very balanced. I love the sunscreen so much I wear it indoors because my skin just feels better with it on. Okay, so that's going to be your basic system. Now, a really important part of your system is going to be the Luminant Face Lotion. Luminant Face Lotion is primarily going to address the appearance of discoloration. This also has retinol in it, so it's very, very anti-aging as well. But there's a number of things. I don't know, have you ever used anything for your discoloration before? Have you ever used any specific products?
I have over the years, and I'm trying to I probably wouldn't remember the names
Was
of them.
it
but
a doctor? Did you go to a doctor?
I did. I actually
Hydroquinone?
did. Possibly. I don't quite remember. But I know
generally the only prescription lightening agents that a physician would have would be hydroquinone. Now they might have different brand names.
Right.
But it's usually 4% hydroquinone is the average.
It must have been.
Did that help?
It did, and I don't know. I don't know if I have to use it consistently over the years for it to really, but it did somewhat.
So hydroquinone is kind of the gold standard, and the reason I say gold standard because all over the world that's probably the lightening agent that is the best known. And so anything that is above 2% over the counter, which doesn't really do much of anything, is considered prescription. And hydroquinone, I personally, I don't have anything against hydroquinone. I'm very well aware of the side effects, but it's banned in a lot of parts of the world, and it's very controversial because there can be side effects, and it wasn't designed to be used indefinitely. And the issue is that when you use it and your skin gets better, you stop using it. Generally, depending on your ethnicity, depending on other factors and environmental factors, it just returns. Some people can even have what's called rebound pigment, which means that it gets better, but when it returns, it's worse than it was before.
I noticed that on my cheeks right here.
So, but again, I think the issue is that if you're a physician, obviously you want to give patients something that you feel is going to work. You don't want the patient to come back and complain. And there just haven't been a lot of options out there. And this really is something that is dramatic for the appearance of discoloration. And there's a couple of different issues. So hydroquinone is what is known as a tyrosinase inhibitors because in order to make pigment, tyrosinase and copper metabolism is what goes into the manufacture of pigment and how it gets thrown off. And a lot of this is genetics and sun exposure and all of that. So that's one element, and it's a tyrosinase inhibitor. But there's another aspect to discoloration, and that is that we all have a hormone in our body. you have as much, I have as much as you do, even though she's not as fair as I am. But if you could be a redhead with freckles that only burns and never tans and have as much of this hormone as the two of us, you do have more of it on birth control pills and you do have more of it when you're pregnant. But it plays a role in how you react to the sun. So I personally don't have an issue with pigmentation. I have other issues with my skin, but I don't know, genetically, that's just never been one of my issues. But there are people that can sit in a hot car. There are people who, it seems like no matter how much sunscreen you wear, what you do, pigmentation is an issue. And then there's melasma and all these other kinds of factors that add into it. So one of the things that we know is that we have to kind of address that hormone. And so that can be a real game changer. But again, this also has things in here that can dramatically affect how your skin looks in terms of the appearance of aging. Okay? So that's going to be something we want to do. Another thing that's going to be really important, because you mentioned the factors that have to do with, loss of volume and just kind of the way that the face moves down and how it changes and flattens out more as we age. So this is something that's going to be, that you're absolutely going to love. This is something called Hyla 3D. This is a hyaluronic acid product, and hyaluronic acid has been around for years. I've been putting it in products for years. You can look at most of our products and you're going to see hyaluronic acid because it holds about 1 to 10,000 times its weight in water. So it's a great molecule because it draws water to the skin as opposed to just putting on a moisturizer and keeping it from evaporating. However, it's a large molecule. It's very short-lived. Now, we know hyaluronic acid is great for volume because people spend $1 gazillion getting hyaluronic acid injections. Hyaluronic acid doesn't actually give you the correction in injections. What it does is it provides a framework for collagen to form. And depending on how much movement you have in the area that you're having it, and depending on how cross-linked it is, that determines how long the hyaluronic acid is going to last. So the reason I say that is because this is a real game changer. This is little tiny molecules of hyaluronic acid that can actually penetrate much more deeply.
Nice.
In fact, just one of the molecules we have in here is 50 times more moisturizing than any other.
Wow.
Hyaluronic acid, and at 24 hours it's still 5 times more moisturizing. And there's a number of other factors in here, but it just makes the skin look so much plumper and smoother, and it looks more volumized. So that's going to be one that you're going to really love. And finally, what I'm going to also have you doing, since you talked about large pores and texture so much, is I'm going to have you working with something called Cleanzyme and Skinzyme. Cleanzyme and Skinzyme are two of my favorite products. Well, everything is my favorite, but I've worked with these products for so many years. What it is, it's a proteolytic enzyme. And in this case, it is green papaya. Green papaya is about 50 to 100 times stronger than ripe papaya, and it has the ability to digest dead and diseased tissue but not hurt normal living tissue. I can even have physicians use this on patients that are sometimes 3 or 4 days out from laser. So their skin's not even healed yet. And it will digest that dead, peely tissue without hurting the normal living tissue. It's so gentle. Scrubs, it's not the worst thing you can use, but scrubs can cause microscopic tears in the skin. That creates inflammation. Inflammation can exacerbate acne, it can exacerbate hyperpigmentation, because what is hyperpigmentation? If you get in contact with the sun, that's inflammation. All of those things exacerbated or could be causative factors. So we want to lessen inflammation. And I work with lots and lots of anti-inflammatories. So, or ingredients that have anti-inflammatory properties. And so Cleanzyme and Skinzyme is something that you could do once a week, you could do twice a week. I do it virtually every night. And it, again, digests dead and diseased tissue without hurting normal living tissue. And when you take it off, your skin looks like glass. Wow. I mean, it's one of my favorite products for that, getting that just really porcelain look to the skin. Okay, so that's your basic system. Now, we're gonna continue to work with you. My assistant is gonna check back with you after about 4 days.
Okay.
4 days is the average time when people make decisions as to whether or not they're going to continue to use products, whether they like them or not. And oftentimes you don't get help, you don't get coaching, so you just end up putting it on your shelf. Average woman has over $600 in product in her bathroom she doesn't use. So I'm going to personally check back with you in about 2 weeks.
Great, thank you.
And one of the things that I always say is that 2 months from now, a month from now, if you say, Jan, my skin is just the best it's ever been, we can make it better.
Wow.
So that's the direction we're going to go in. Do you have any questions for me?
I don't. I'm excited. Can't wait.
Good. Well, I'm excited too. I can't wait to see how this goes. And please, thank you so much for watching and subscribe. Bye for now.